SBU in situ, direto de Santo Antônio, Texas, na AUA 2024. Tenho o prazer de estar aqui agora com o Dr. Timothy Everke, um velho amigo e conhecido. Dr. Timothy, professor of University of South Carolina. He has just finished a moderating post-URS stent at the plenary session here at the AUA meeting in 2024. This stem is very interesting because there in Brazil, it's very common that at the end of a ureteroscopic procedure, the patient ends with a stent. Very, very common.
Yes.
I'd like to know from you how it happens in your practice here in the U.S.
Yep.
and how to handle with the patient discomfort and complaint.
Yep.
So it's a pleasure to see you again after so many years. Dr. Timothy has been already in Brazil many years ago, and always gentle and kind, and I have this opportunity to listen to you, and all Brazilian urologists who are listening to you about the post-URS stent.
Thank you, Fernando. I appreciate you finding me and allowing me this opportunity to speak to some old friends and new friends. So I think post-ureteroscopy stenting is something that we as urologists see all the time, and we have to deal with on a regular basis. The challenge starts in the beginning when you first meet the patient, and that's when you have to understand, what is the situation the patient's in, what is their background, have they experienced pain before, have they maybe have depression. These are some clues, even in the very beginning, that tell you there may be problems after the ureteroscopy with the stent. Then you get to the operating room, and you have to decide maybe the patient shouldn't even have a stent when you're done. And there's a whole conversation about who is the right patient not to leave a stent in. And certainly from the US data, that number can be as high as 10 or 15%, even as high as 50% in some series. But most people will consider a stent, or at least not leaving a stent, in some. Certainly even in my practice, I've gotten to the point where it's probably at about 5% of my patients that are being not stented, and some practices are much larger. If you do leave the stent, then what do you do after? That is the challenge. So I think if you've handled it ahead of time and really explain the expectations of the patient, what is life going to be like with a stent? And that's the first step. Once you've established that and they know about that, you say it again after the surgery, and you counsel them best on when is the best time to reach out to you rather than waiting for them to figure out when to reach out. So I think those are just some basic between the patient and the urologist relationship. I think then when you get to what medications can you use to help, I think that's very important. Certainly in the US, there's been a great movement to go away from opioids. I do ureteroscopy completely opioid-free, except in the rare patient that's had exposure before and is going to have pain. Everyone else gets a strong non-steroidal. I also believe in tamsulosin, an alpha blocker. I'll even, as we've heard in some other lectures, the data shows living with a stent with an alpha blocker, there's less symptoms.
You use for all patients in the post-op?
All my patients. And because many of them will have been started on an alpha blocker for medical explosive therapy, I continue it. But even in some patients who've never exposed it, I do give it a few days before. Because then it's in their system to even start helping them with the stent. Because as one of the presenters in my panel showed, that the stent symptoms are really the worst the first 2 days. That's after 2 days they start to taper off. But if you have that medicine on board right from the beginning, I think it's helpful. And then thinking about things like getting the stent out as soon as possible. We leave a string on if it's appropriate to get it out sooner rather than have to wait to come to the office. We could talk about stent materials and stent types of stents too, but the data is just not there to really hold us to some one pattern just yet. Someday I think we'll figure it out, but we just haven't yet.
Okay, I think that like a conclusion, that we have 3 stages: pre-op, intra, and post-op, and a selection of exactly the patient that could have problems or not with the stent.
Right.
Perfect. I'd like to thank you, appreciate for your time here, and congrats for your moderation at the plenary session here at the AUA meeting in San Antonio, Texas. And nice to see you again after so many years.
Great to see you. Thank you.
SBU in situ, Santo Antônio, Texas, AUA 2024.